there, I'm Melissa Lee, and this is
Linda Rudd.
We are both occupational therapists, and we have specialty training in pelvic floor dysfunction. Probably, I don't know, back when I was 12, 13, I remember reading in magazines about Kegel exercises and pelvic floor exercises, and on the newsstands there would be, in Cosmopolitan or, I don't know, even People, something like that. There would be articles about how to do them correctly. And they would say, oh, just do them when you're sitting at a stoplight or, before you go to bed at night. And so I thought I was always doing them the right way. Come to find out, though, up to 75% of women are doing them incorrectly. And so it's not really helping. So Linda's going to tell you how you can try to do them the right way.
Okay, so today we're going to have just a little bit of an anatomy lesson. I'm going to show you some pictures, and we're going to talk about just kind of the muscles that make up the pelvic floor. So it might be hard to see because this is not too close up, but you can see that the pelvic floor makes a bowl in the bottom of our pelvis there, and these are the muscles that support all of our organs. So they support our uterus, our bladder, and the rectum. And these are the muscles that can kind of get weak or certainly experience trauma during childbirth. And not just necessarily vaginal childbirth, even women who've had C-sections because of the pressure of the baby over 9 months experience weakness or trauma to the pelvic floor. So we're going to talk a little bit about the Kegel exercise. The interesting thing about the Kegel exercise is that it's not, it's a very finite and very small motion. And so I think a lot of times, I know when I was practicing before I received the certification in the pelvic floor therapy, I was focusing on contracting really hard and closing all of those muscles. And what I've learned since then is that the overflow or the use of all those ancillary muscles, like when we cross our legs to try to hold, if we have to feeling that sensation to go to the bathroom, or if we're accidentally squeezing our abdomen muscle at the same time, we're actually overriding the benefit of the Kegel exercise. Mm-hmm. So to start, when you're first trying to figure out what is this muscle, what is this exercise, how do I control it, a good way is to try to stop your urine while you're voiding. Now you want to wait till the bladder's at least half empty, and I want to stress that this is not a way to practice. I have known doctors that have given the suggestion, just stop and start your pee while you're going to the bathroom. Absolutely incorrect information, because you can kind of train your bladder to not empty all of the way. And now you're left with residual urine, and you're giving mixed signals to the brain and to the body about what's supposed to be happening during voiding. But it's a good way to start. It's a good way to try to figure out what it means to do a Kegel exercise. Now, some of you are going to find that your pelvic floors are so weak that you probably can't stop the urine completely. However, at least it gives you the sensation. Now, the idea is not to then keep trying to contract harder and harder and using all of those ancillary muscles to make it stop, but to just have awareness of that finite movement that occurs. So one of the other strategies when you're not voiding or you're trying to practice your exercises, your Kegel exercises, is to just have the sensation and pretend like you're trying not to pass gas. Okay, and it sounds disgusting, but we're all there, we've all done it, whatever. So just, you try that sensation, again, very finite. When the pelvic floor is contracting, and only the pelvic floor, because isolation is essential to doing the Kegel correctly and being able to prevent incontinence or leakage. When you're trying to contract that pelvic floor, it might move, I don't know, an eighth, a quarter of an inch. I mean, it's not like a bicep where I'm getting 180 degrees worth of motion, it's just a tiny little contraction. So that's how you're going to start trying to do the pelvic floor. One other strategy is after you're done voiding, if you're sitting on the toilet, or you can be doing this while you're sitting in a chair, is something that we refer to as the post-evacuation maneuver. And we refer to that is that because some women, or people in general, that have weak pelvic floors are also having difficulty with being able to, I don't know how to say it,
completely eliminate when they're having a bowel movement.
Right, and sometimes you'll find that when you're wiping, you continually are getting bowel movement, and that's because that pelvic floor is not closing off that anal sphincter all of the way, and so stool continues to leak. So one of the strategies, again, the post-evacuation maneuver, is very simple. You'll have your legs apart, hands in between here, and you're just going to press very lightly. This isn't like some huge adductor muscle that you're doing at the gym. You're really just focusing on getting that pelvic floor to close. And so you'll push on the inside here, and you'll squeeze just lightly, 1, 2, 3. You don't want your abdomen overworking. You don't want a ton of contraction in your adductors. You really just want to feel that sphincter close. And you'll notice immediate results if you are having the leakage with the stool where you're doing that continuing wiping. So you can do 1, 2, 3, very light. And then hands on the outside, 1, 2, 3. Hands on the inside, 1, 2, 3. And to do a series of 5 or 10 of those. So it's a nice way to incorporate it into your routine if you do it immediately after voiding. You can try it once or twice in the middle of voiding so you can see that you can get that contraction that you're looking for. But again, do not practice while you're going to the bathroom. That's some of the worst advice that I've heard so far. So hopefully that helps you. What I do recommend, we oftentimes recommend, is starting in laying down. So once you master that sensation, you understand the feeling that you're supposed to have, a good place to start doing that is while you're laying supine, supine. So you want me to demonstrate it really quick? Okay. So you just get down, it's just as simple, just laying down with your knees flexed, and you're just trying to close that sport. It feels so weird because it feels like I'm not exercising at all, like I'm hardly doing anything, but I'm really just trying to close that pelvic floor. And I want to make sure that I'm not contracting my abdomen. So I'm going to have my fingers here, and the sensation that I'm trying to get is the floor lifting up, like I'm trying to pull something in. If you feel it pushing out, that's the absolute wrong motion. So you don't want that for sure. And again, you can also do your post-evacuation maneuver here, where you just put your hands in here and do a slight squeeze, hands on the outside and a slight squeeze. Very light. So hopefully that gets you started. You may have difficulty. I guess I just want people to understand that it's not, first of all, the pelvic floor, the Kegel exercises will not cure absolutely every type of incontinence, because there are times when people have spasticity, when that pelvic floor is actually too tight. And it's constricting, and it's over contracting, if you will, and forcing urine out of the bladder at inopportune times. So sometimes that's hard to know without an evaluation. And also that it takes time. Your pelvic floor may not have worked correctly for a long period of time, and so you're going to need to do these exercises, 3 to 6 months to see significant results. And of course, it's important that you're doing them accurately. So if you need additional assistance with that, we have strategies, tools, computer-assisted electromyography that can help you really understand what your pelvic floor is doing while you're trying to do those exercises. So
We hope it helps. Have a wonderful day.
thank you.